I was a member of the CCF, yeah, and then the NDP, and incidentally, I attended my first meeting in 1933 when my uncle from Kelowna spoke at a meeting at Melness School just out of Saskatoon here, and I was there.
Cooperative Commonwealth Federation, CCF. That's what I was brought up on. Our family believed in it, and Mum and Dad fought for it, and fought for Tommy Douglas. And Tommy Douglas came to our town and spoke in the hall, and I wasn't all that big, but I was there at the meeting, and I met Tommy Douglas, and his ideas are still in my heart and my mind. Yeah.
Well, I think that this leadership is going to provide an opportunity for rejuvenating the party. And I'm looking forward to. There's been a lot of rejuvenation gone on during the time that these four fellows have been debating and going around the country and talking. So there's a lot been happening, but it's got to continue to happen, and that's why I'm looking forward to the final leadership vote and the new leader getting into action.
I do particularly like Ryan Miley. He speaks of having new conversations and consultations with the people of Saskatchewan, and reaching out to other people, and all people that have progressive ideas about healthcare, education, about all the different ways that affect people's lives. And sometimes we don't know that unless we have those conversations. And I like his vision, as he states in the book, The Healthy Society, that a society isn't healthy when all people can't take part. And when we have so many people in poverty and so many people homeless, and these people have no voice, they really cannot contribute to a healthy democracy, a healthy society. And so that spells a new way. It spells a new vision. It spells a way for us to go forward and do better than we've done. I see the things happening now that are taking away the very things that did help us, and through the CCF governments that we got health care, we got hospitalization, Medicare, public health, so many programs for the people. And I saw what happened when the CCF were defeated, and how some of these very gains were taken away.
Well, I'm looking for a leader that is interested in involving the people and listening to the people, and that has a philosophy that is concerned about the people, about health and education, and but I think in particular about involving the folks and getting information from them as to what they feel are the major problems that they're concerned about, and then who's prepared to do something about it.
We have to do things a new way. We've got to think about speaking to the people, to reaching to progressives, to find out where we have likes and differences, and work on the things that will help us the most.
A leader needs to be prepared to take ideas and carry them forward into policies and programs, budgets that are needed to get them into action. Now, I feel a leader needs to do more than just talk. He needs to do a bunch of listening.
Certainly see Miley with a vision. And he's traveled all over this province doing Medicare. He's a doctor for Medicare, for one thing. And he has done medicine in many of the poorer communities in the north and in the communities of the south. And so he has seen a lot, and he's understood a lot of their problems.
Well, I'm going to be supporting Ryan Miley, and I'm impressed with Ryan's concern about health, about education, about the things required for people to have reasonable living conditions and lives, and who is prepared to do something about it. Well, many times I've seen leaders that are prepared to do things that other people say aren't possible, that you can't afford them, and or you just can't implement them. I'm thinking, for example, of hospitalization. At the time it was put in 1947, and people were saying we just can't afford it, you know. Then, when power was distributed throughout the province, there were lots of folks that say that we just can't afford to run power to all of these farmers in Saskatchewan, but they did it, and then of course Medicare was another key one, that where there were so many people saying that we just can't afford this, so we couldn't afford not to, because people were going broke. Paying doctor bills, hospital bills, and so I've experienced many cases where people had ideas about to improve the welfare of people, and where the naysayers would say that it isn't possible, we can't afford it. And but I think that if people need these things, I think we can afford it. And the fairest way, or at least one of the key ways of affording it, is through our taxes. So rather than paying big doctor bills, I'm paying taxes regularly. And so I think that it's feasible. And also, we've got a lot of resources in Saskatchewan that we're giving away to big corporations, and that we should be having more of that money available to implement ideas to help improve people's lives.
Think about new ways of reaching out, having conversations, and find the best route for Saskatchewan.